Welcome to the BrainRich Podcast, where we explore the incredible journey of each childhood development, parenting, and the science behind learning through play. Dr. Emily Space is a doctor of physical therapy, specializing in pelvic health neonatal care. She's also a licensed massage therapist, perinatal yoga teacher, and international board-certified lactation consultant. Dr. Emily's passion lies in promoting holistic wellness and early intervention for optimal infant development. Today, we're diving into expert insights that help parents create a supportive environment for their little ones to thrive. Let's dive in.
Beautiful. I'm so excited to get started.
Thank you for joining us here today. Dr. Emily, I'd like a little story behind it. How did you get started with this profession? What got you into it?
Wow, that's a great question. I think a lot of therapists are wondering at this very moment how to get into neonatal therapy because it is such a niche. For me, I was just lucky and I asked the right questions at the right time. My first job after I had my first daughter was as a physical therapist. I had a lot of other jobs before I became a physical therapist. As you mentioned, I was a yoga teacher, massage therapist, and after PT school, most of my background and training ended up being in babies. And I've always been drawn to babies. I was one of those 12-year-olds who was already babysitting the 6-month-olds, but I really believe that babies are so cool and so wise and have so much to teach us. And it's really important to show them respect. And so I knew that I wanted to work with babies in some capacity, but my first job was in a pediatric hospital. And I found out that their NICU didn't have a physical therapist. I went to the director of rehab and I said, "This is not acceptable. You need to have a physical therapist in your NICU." And he agreed and got me a position. I didn't realize at the time that I would be asked to take that position. I immediately dove into all the continuing education I could possibly find on tiny babies. I understood babies. I understood infant development after the newborn phase, but the NICU is a very different animal. So now I was learning week by week development from the time of the time of conception. Ended up being a resource for other therapists learning about these tiny babies and helping to train other people in the NICU. And there's a really long story for how I ended up moving from the NICU to my own business. And I'm happy to dive into that if you'd like.
I'm going to cover up a little bit because if it's something that you think a lot of people would be interested in, yeah, sure, let's cover.
So I ended up moving from the NICU to my own business just because I saw that there was this enormous gap for almost every family that we worked with. Now, we had a really wonderful clinic that bridged the gap for some of the babies who had the most severe outcomes from the NICU, but those babies who were in the NICU for 6 hours or 2 days or even a week, those babies didn't qualify for the level of care that some of the other babies were getting, but they still were having trouble eating or having trouble developing appropriately. And I ended up being part of a free craniosacral clinic in my community here in Portland and seeing all of these babies on the other side of the NICU who I knew I could help and whose parents just had no access to that kind of help. So that's how my business was born.
That's awesome. If you look at your life, some of those little kind of signs almost guide you to your true purpose, right?
Oh, yes. Every step of the way.
It's amazing. And I appreciate, from speaking of moms, I appreciate what you're doing, what you've done. I know a lot of moms, especially if it's a first newborn, just happen to be in a situation where you have to take care of baby, look for resources and you don't know where to look for it. It's a huge thing to carry to process. Plus you have to take care of your own body postpartum as well, right?
And there's so much conflicting information that makes it really hard for parents to figure out what the right thing to do is.
Exactly. Well, awesome. Okay, let's dive into some of the questions. Let's see, how can physical therapy support women in preparing for childbirth and recovering, especially concerning the pelvic health?
That's a great question. One of the things that I think about is that our bodies are designed to move efficiently within gravity, but we spend so much of our time doing things that are not efficient, like sitting in front of a computer, for example. And that trains our muscles and our bodies into different positions. So it shortens our hip flexors, lengthens the back of our body a little bit. It might even create more of a rounded shoulder and forward head posture. I probably am sitting with a forward head because I'm like trying to come towards the camera. And we all do this. We want the angle to look good when we're on Zoom. So I think that one of the things we need to think about as a pregnant person going through their pregnancy is finding posture and movement that feels really good. And part of what is important to do is move your body in a way that will strengthen the muscles that are too long and maybe too weak, and lengthen the muscles that are too tight and probably too weak. That's some of what I do with clients, is just help them move their bodies in ways that will make childbirth and your pelvic floor ultimately make everything work efficiently together to avoid complications. Specifically for the pelvic floor, I would say that a lot of the movements that I recommend address your pelvic floor. Even if you think about just moving your hips in different positions, side to side, every time you move your hips, you are addressing your pelvic floor and moving your pelvic floor into a different position. So one of the biggest misconceptions that I hear is people being told that they need to do Kegels to strengthen their pelvic floor. And I think that this is becoming more mainstream, that the idea that most of us actually have a tight pelvic floor, and tight means weak in this case. You can't sort of strengthen a muscle that's short like this. You need full range of motion. Working with someone who understands the full range of motion of the pelvic floor is very, very helpful.
And then when we're talking about the postpartum, if we can touch on what would be the difference recovering from C-section and recovering from the natural birth?
Great questions. When you are thinking about a pregnancy, the baby is growing in the same way, regardless of how it comes out. And the weight on your pelvic floor is increasing throughout your pregnancy, regardless of whether you have a vaginal or an abdominal birth. So even if you have a cesarean section, you can end up with incontinence. You can end up with pelvic floor dysfunction. The postpartum healing will take a little bit longer with an abdominal surgery. It is a surgery, and they cut through 7 layers of fascia and muscle, and it's a lot to recover from. But depending on the severity of any tearing that happens in a vaginal delivery, you may have the same trajectory of healing. I also think that a common misconception is that you go to your OBGYN at 6 or 8 weeks, and then they tell you you're cleared for activity. But I have yet to meet a person who's ready to just go for a run at 6 weeks post. And by ready, I don't mean mentally, because sometimes all we want to do is get out of the house and go for a run. But most of the time, that's not the appropriate time for you to be starting to run. And there are so many steps before that I want to make sure that your core is stable. I want to make sure that you have all of this incredible stability in your body before you are moving towards running or any other physical activities. And it doesn't really matter if you've had a vaginal or a cesarean delivery. I'm more conservative with a cesarean, and there's a lot more scar tissue mobilization involved, but there might be some for a vaginal delivery too. Just depends on how everything went.
What would be 3 tips for a postpartum recovery? So let's say like first 6 months, what would be your probably 3 main tips for women?
If you have a partner, make sure that your partner understands that your entire job postpartum is learning how to feed your baby and bond with your baby. They will also have opportunities to bond with the baby. But if you've chosen to breastfeed, that is your job. Your job is not cleaning dishes. It is not going for walks. It is not doing the laundry, especially in the first 2 weeks postpartum, if your partner can do all of the cooking and cleaning for you, that will be an incredible benefit to you, not just because you want to get back to what you looked like before baby. It's all about being 75 and not peeing your pants.
The first one.
The second one is, I know that people watching this and listening to this are interested in being active and playful and moving with their babies. I really think that encouraging independent play in your infant gives you the opportunity to move your own body in a way that feels healthy and good for you. And if you can both be sort of playing independently, it can be an incredible benefit to you. The third thing is, if it's taking a long time for you to feel strong again or for your body to look a certain way again, don't hesitate to ask for help. Don't hesitate to reach out. I am working with someone right now who's 4 years postpartum, and we're doing a return to running protocol. If a provider ever tells you you can't ever do something again, get a second opinion, because there is likely someone out there who has expertise who can help you rebuild your muscles in a way that gets you where you want to be.
Sounds good. Thank you so much.
Welcome.
I know it would hit different if you're first time mom or about to have birth, or if you already have multiple kids.
And I know that a lot of people hearing this who have more than one kid are like, yeah, right, don't like leave my room for the first 2 weeks. Yeah, I mean it. Like, your partner's job is the other kids. I did not leave my room with my third baby. I did not leave my room for 2 weeks. That doesn't mean I wasn't moving. I was very active, like rehabbing myself in the room, but I did not cook. I didn't go downstairs. I allowed my tear to heal without stitches. And I was only able to do that because my partner took on everything else. And I think partners hearing this might be like, oh, I could never, but you can. And it actually helps with your bonding with your older kids. And they need that right now when there's a new baby in the house.
That's so true. Yeah. I was kind of lucky because my first one was the hardest, I think, because, well, newborns, first week, you're fine. They sleep for the most part. Second, third week, they start being more aware. And that's what it's like, okay, what do we do now?
Yeah, I love the question of what do I do now with this newborn? I have so many ideas.
Share some.
So I think it's so common for families to look at their newborn and think, oh no, what do I do with this thing? It's awake, and it can't play, right? But it can. And so if you can reframe what play looks like for a newborn, it can be so valuable for your experience postpartum. First of all, with a newborn, anytime that they're awake, and I of course, I am an IBCLC, I'm a lactation consultant, so I work with families where the baby's not eating well. So what I usually say is, anytime your baby's awake, don't wait until they're eating their hand or they're like moving their lips or they're crying. That's too late. The first time that they're alert and awake and they're a newborn, they're ready to eat. They're hungry. That's why they're awake. And so that's the first thing. If they finish eating and they're still awake, especially after those first 2 weeks, you're going to have longer and longer stretches where the baby's awake and kind of like, you're like, what do I do? So putting the baby prone, putting the baby in tummy time is really, really valuable. But I have a really specific way that I teach families to do this, because a lot of people will just kind of plop the baby on their tummy and then the baby cries and they're like, they hate it. And they pick the baby up. This is my NICU sized baby. I'm going to tip this down so that maybe you can see.
Mm-hmm.
If I were holding a newborn, I would keep them up against my chest as long as possible, and then place them down, their butt first, and then have them try to make eye contact with me. By the time a baby is born, they should be able to make eye contact. So slowly bringing them down so that they don't elicit the Moro reflex. And then you can tell your baby, it's so important to talk to them. This helps with their language development, their cognitive development, and they have better receptive language skills than we could possibly imagine. So, all right, baby, I'm going to turn you onto your side for a minute. You ready? And then we go to the side, and I'm going to place my eyes in line with hers. Just like this. I'll actually go this way. Hi, baby. You ready? We're going to go onto your tummy now. And then I'll pull gently to help her get onto her tummy. And she might face plant because she's a newborn. She doesn't have the best neck strength. But then I'll bring my face over to the side to see if maybe she'll turn her head to the side. Maybe I'll even put a hand on her back and say, I'm right here. And we're just going to be on your tummy for a minute. What do you think about this? And then maybe she'll lift and turn her head to the other side. That's a skill that I'm actually looking for as a physical therapist. And then if your baby's like fussing and showing you that they are not interested anymore, you don't have to immediately go, oh, it's okay, we're not going to do it anymore. I would go like this, have them turn their head towards you, help to scoop under their arm, and then look at them and be like, we're back on our side. And then come onto your back. How was that? And then pick them up. And all of that is helping to create a motor plan for their brain so that their brain understands what rolling is. It is so important for their vestibular system and just their feeling of safety when they're rolling, so that when they're 3 months old and it's time for them to roll, the first time that they do it isn't scary for them. They've been doing it all along.
Do you, by any chance, do any grasp reflex? Like, do you practice handing the baby?
You mean like pulling them up? So you can. It's a test that sometimes I will look at their head control that way. But with a newborn, the newborns have a grasp reflex in their hand and in their toes, right? So if you have them by the grasp reflex, you can help to kind of support them as they come up. When I'm testing a newborn's head control, I'm expecting them to be pretty much here, and I don't need to see that most of the time. Like, I don't need to see their full extension because I'm expecting it. So it's not something that I test frequently. When they're about 2 months old, I want to see a little bit of a chin tuck. And when they're 4 months old, it should be like really clear chin tuck. They can pull to sit really easily. So maybe around 3 months, you can play with that. It's not a bad thing. I just don't usually recommend it right away. With the grasp reflex, that is a way that you can actually help to calm your baby. So they're going to be so much more organized in the way that they can be in the world if they know where they are in space. When they were inside a uterus, they were able to kind of kick out, and then the uterus pushed on their head, or they pushed their head up and then the uterus pushed on their feet. And so when they're out in gravity, it's so overwhelming for their brains to know where they are in space. And if they start to do things like this is a stop sign. It's really helpful to bring their hands, grasp reflex, and then back to their face or back to midline, or give them a little boundary at their feet or a boundary at their head. And that just all really helps them know where they are and create a little map of their body in space.
That's so awesome.
Yes.
Aww.
So tummy time is kind of the big thing that I start to recommend, but there's others, and I'm happy to go into them if you think there's time.
Sure.
All right. So some other things that I love to do with newborns are placing a baby right here, because it helps them with midline orientation. And we really want their eyes to be able to see us at midline. So if you're here, usually your newborn's going to be bigger than this. So their little booty would stay here and their feet would be up against you. But the important piece is that their head is between your knees, in this little like crook between your knees. And so you can move your head slowly side to side and have them follow you with their gaze. But one thing to really keep in mind is that their brains don't process as quickly as ours. So when you are moving your head, you can't expect them to immediately follow you. You need to wait for them to process, oh, she moved to the side. Now I will move my eyes to the side. It takes a little bit longer. And so if your baby is not tracking you right away, don't freak out. Just go slower and move less and give them time. So visual tracking side to side is a really, really wonderful one as well. And I think a lot of parents have this misconception that they need all these toys. And in the first 3 months, your baby is so much more interested in you and your face and the contrast of your face, especially if like dad has a beard or mom wears glasses, or there's just so many interesting things about you that they care more about than a rattle. Not to say that they won't eventually care about a rattle, but In the first few months, they really care mostly about you, and they can't even see that far. So getting nice and close to them and giving them things to look at is really, really helpful. I also love to think of newborns as this incredible opportunity to slow us down, because so many parents are like, I want to do the best thing for my baby. I want to help them develop really well. And one of the most incredible gifts that you can give your baby is independent play. And so putting them on their back next to toys, don't hand them anything, just put them next to the toys, and maybe there's something hanging over them, and sitting back and observing them. They will show you what they're interested in. And play for, say, a 2-month-old might look like laying down and looking at the same ball hanging above you for 5 minutes, and then lifting your hand and touching it. And that's it. And that is an incredibly complex skill for a baby. And it's so amazing if we can sit back and allow them the space to do that by themselves without our intervention.
That's so true. Emily, can I ask you a favor? I think sun kind of, yeah, perfect. Perfect. We can, yeah, can still, yeah.
The sun is starting to come.
I mean, I'm glad you have sunny weather in Portland. I'm super happy.
I know, it's beautiful blue skies today.
Yeah. No, it's whatever you were saying. I notice, like myself, if I look back at myself with my first one, with my second, with my third child, right? The first child, I don't want to say I'm like a helicopter mom, but I was always alert. You know, it's like, oh my God, she just like cried. Oh my God, she just did this. Oh my God, she peeped, she pooped, she did. I was exhausted. It was super tiring. And I mean, some kids, they do need extra attention. As you said, there are different cases, right? But I think it was part of me being inexperienced, right? And I mean, babies don't come with manual, right? You have to learn all their cues and stuff. But what I've noticed with my first one, I kind of, all the way to first year, I was super alert, and it was exhausting on my side. And then when my second child came, I didn't do anything special with her. I mean, it's not that I wasn't alert. I was alert, but I was giving her more time, as I'll say. If she would be crying, I maybe part of it because I learned those cues, those baby cues, why baby could cry and kind of things like that. So I was less panicking. Mm-hmm. And I think she knew the energy because she was way more calmer. I mean, my second one, until 18 months, I didn't even hear her. I was like, is this possible? How come my first one was so active? Yeah.
So interesting too, because we think about, why does it have to be like that with first-time parents? And I really believe that it's because we don't bring our babies out in society as much. And so we don't see other people parenting, and we don't see babies, and we try to give people space when they have a baby. And I think that it's doing a disservice to us to not like have the village of people all around having babies and being around each other and in someone's house and thinking, I got to put my baby to sleep. And we just silo ourselves so much, and it makes it hard for first-time parents because they're like, I've never even seen a baby. Of course I'm anxious.
Yeah, that's true. Yeah. But I mean, it's a good experience still.
So another wonderful play activity for a newborn is massage. And this is something that I teach every family, even if that's not why they're coming to me, because it's usually helpful for whatever it is they need. And one of the biggest pieces and the most important pieces of giving a massage to a newborn is asking for consent and remembering that consent is ongoing. So just because you gained consent at the very beginning of your massage doesn't mean that they're still giving you consent for the next body part. So I just have a very specific way that I teach parents to look for their baby's consent, and that helps them understand, like you were talking about, their baby's cues, their baby's cries, and just learn the language of their baby.
That's so beautiful. So cool. So Emily, what would be the benefits of early intervention for newborns, and how can parents use play to support their baby's development? I think we did kind of cover the exercises, the activities that you can do, but can you also touch a little bit on why do parents have to do it?
Yeah, there are 7 different domains when I think about incorporating play for a newborn and through infancy. First, I am thinking about motor skill development. Of course, as a PT, this is my domain, right? Play really supports the development of gross and fine motor skills. So it helps babies do those things like rolling and sitting and standing and running ultimately, right? And then the fine motor skills are the pincer grasp and the grasp, all the little grasps that babies are doing. And it helps babies build the strength and coordination that they need for all of their motor milestones. It's really, really important. The second domain is cognitive development. So when we think about a baby playing, we are stimulating their brain growth. We're promoting problem solving, cause and effect understanding, and overall cognitive development through the exploration of different activities and all the different things. I think about it gets kind of granular when I start talking about problem solving, but all I'm talking about is if we put a ball under the baby's going to want the ball. So they're going to move the cup out of the way. That's problem solving for a baby. So the third thing is social and emotional development. Play really strengthens emotional regulation because it can be frustrating. And it also increases bonding and attachment because when you're frustrated, you look to a trusted adult for co-regulation. And it is so important for babies to have trusted adults, not only the parents, but anyone that's around that can help with co-regulation without rescuing. When we put that cup over the ball and the baby hits the cup and can't get the ball and they're very frustrated, to lift the cup up and let the baby have the ball is potentially seen as a nice thing to do. But what it's actually doing is teaching them that they can't do it by themselves. So what we want to do is sit there and encourage them, maybe not say very many words, like, yeah, the ball is under the cup. You really want that ball. It's really, really helpful to be there with them and they can experience it with you rather than having you rescue them from the difficult situation. So that's how it helps with social and emotional development. And then physical health and prevention. So if we're just thinking about a baby who learns to crawl and then has like free reign to crawl all over the place, they're going to burn more calories than a baby who's not able to do that. So it just helps healthy muscle and joint development and supports overall love of movement for a baby as they grow up. Fifth one, I think we're on the fifth one, is sensory development. So babies who are able to play with all these different things, different textures, different lights or colors, and different sounds, it all helps babies sensory processing. And babies are learning and processing so much from the time they're born. It is overwhelming for their brains to be in this world because they were sensory deprivated in the womb, right? They could hear, but it was muffled and not quite as loud. But every single time a baby comes in contact with a new texture or hears a new sound, they are creating neural connections in their brain that helps to build spatial awareness and sensory awareness and tolerance of different sensory experiences. Okay. The last one is language and communication skills. And I talked about this a little bit with how to get a baby into tummy time, but narrating everything that you are doing is so golden for babies because play, especially with the caregiver, the mom and the dad, the trusted adult, it fosters early language development and really helps babies learn the cadence of a conversation. And it gives opportunities for babies to listen to speech and mimic sounds and really engage in those really early communication moments through their gestures and facial expressions. And, if a parent or caregiver is saying, yeah, it's frustrating that you can't get the ball in the hole, I bet, then they're also understanding empathy. They're gaining so much. So those are the 6 things that I'm thinking about when introducing play to newborns and infants.
Oh, that's so beautiful. I'm reliving my kids' early days. It's so beautiful. Yeah, now that I remember, I did a lot for them too, as you kind of mentioned. I didn't know. I mean, part of it I did know. It helped me to read some books that I read on time at a time. It was Montessori 0 through 3. I think once I found that book, I was like, oh my God, it makes so much sense. So I kind of follow a lot of the Montessori teaching.
Yeah.
And I did have them area on the ground, just on the floor, kind of put like a little blankets, just put toys. And before they even crawl, I would lay them on the floor and just put a mirror on the wall so they can kind of start learning the room.
Mhm.
That's what I did. And my dog was always around them, so they could see her, they could touch her. Yeah, so
One of the
it was.
biggest things that I try to instill in my families is the floor is the absolute best therapy tool that you could possibly buy. I'm going to do an Instagram post about this because you can't buy any container that is going to help your baby develop faster than being placed on their back on the floor or on their tummy on the floor. That's just going to help them learn about gravity so much more efficiently than being in any rounded container.
That's so true. Yeah. And I do attribute that to my kids as well, because they pretty much, I mean, whatever milestone schedule you have, we were hitting it like
Mhm.
perfectly, even sooner sometimes.
Yeah.
And I do attribute it to like being on the floor a lot. There's time and time just crawling everywhere they can.
Yeah.
Yeah,
Yeah.
that's
I think there's some parents get really, really caught up with the timing of milestones. And I will just say every baby is different. There are some babies who are working on those cognitive milestones and talking and mimicking sounds way before they should, and they're not crawling yet or they're not walking yet, but they're communicating really, really incredibly well. We all have strengths and weaknesses, right? But I've run into some families who are like, well, they'll do it on their own time. And I really believe that getting a physical therapist or an occupational therapist, somebody who's an expert in baby development, to help show you just the little ways that you can help enhance your baby's experience will lead to better sleep, less frustration, better eating, probably. It's just, there's so many benefits that there's no reason to wait and see if your baby is a little bit delayed. I've there's 2. I don't ever want to freak anybody out and make them think there's something wrong with their baby. But if their baby is clearly frustrated, there's no reason not to give them a few tools to help them along their way. And there's just some really simple tips and tricks that we have as therapists that are second nature to us, but it's not the language that most parents speak. So
my advice would be also just going to add into your words, trust your instincts as a mom, because if you're sensing, if you're feeling, that's your best bet. If you're feeling something, just go and seek the advice, and don't just maybe ask one person. Just if you're really feeling it, you have to kind of go into the core of what you're feeling. You have to.
There's a biological reason for that. Our brains in pregnancy are rewired to protect us and to protect our babies. So your intuition has never been better than when you're pregnant and postpartum. And that is by design. It's to keep our species alive. But as a wonderful thing in our lives, you can trust yourself. And really, like, if your pediatrician tells you there's nothing wrong and you just think there's something wrong, then there probably is. And you're probably right. And you should go seek as many opinions as you need to be able to find the person who's actually speaking your language.
Yeah, and in my experience, for example, with the third baby, I did a water birth, right? It was all natural, no complications, nothing. But when he was born, we realized he had a tongue tie. My first 2, I never even looked in kid's mouth, right? No, I didn't even heard about tongue tie. Wow. But my midwife, thank to her, again, she she was experienced enough to realize the problem. He did latch okay, but he still had that problem. So he was a little bit fuzzy the first couple of days. So we had to do we had to clip tongue-tie, I think day 4 or 5, something like super early on, right? And I'm super grateful for her telling me, because I know some women, they don't even realize that have that problem. And it triggers down to even more complex problem like latching, not sleeping enough, the gases, and all those issues, just because of one simple thing, right? Your pediatrician forgot to look, or maybe mislook at the tongue tie issue, for example, right? And you can probably share from your experience some of those minor issues that could later on trigger.
Yeah, I mean, the big one, tongue ties are so controversial right now. And really what it comes down to is every single case is different. You need someone who will do a full body assessment on your baby if they have a tongue tie, because it's never, ever, ever just the tongue. But that's a different podcast for a different day. So another one that I see frequently is a head turn preference. So baby looks to the left and they like to spend most of their time looking to the left. And parents will say, oh, my baby doesn't hold their head in the middle. They're only to this side or this side. And to me, that says the baby doesn't have great head control because they're not able to use these deep neck flexor muscles to hold their head in midline. But if a baby starts with a head turn preference, they can develop a little flat spot. And if they develop a flat spot, it can lead to a greater head turn preference. And if they have this greater head turn preference, it leads to a worse flat spot. And then they get this whole slew of things. But the biggest things that I see are usually with a head turn preference, you also get a tilt in the opposite direction, because this muscle here is usually the culprit for torticollis. Turns your head to the opposite side, it tilts your head to the same side. But when I see the pediatricians really kind of drop the ball, no offense to the pediatricians out there, you have to know so much. But in these first few weeks, when parents are like, oh, it looks like my baby is kind of tilted and scrunched to one side, most of the time that just gets waved off like it's no big deal. It actually does make a difference for babies, and the tilt of a torticollis is much, much harder to get rid of than the rotational component. So if your baby is kind of tilting and scrunched to one side and it's always the same side, you need to have someone who's an expert at looking at baby bodies, look at your baby and give you some things to work on with them. And maybe get some craniosacral, maybe get some infant massage that's really tailored to your baby. Learning infant massage is probably the best thing you can do, because getting your baby body work once a week or once a month is not going to be as effective. And torticollis is very, very treatable as long as we do it as soon as possible. If we start trying to treat it at 6 months, it's really, really challenging to get rid of.
Yeah, that's so true. So maybe my next question kind of was what were you talking about before, but maybe you have another example. So can you please share an example of a baby who overcame developmental challenges through physical therapy, and what role did play have in that journey?
I love this. So I'm thinking of a baby who actually just had a baby sister, and now I'm treating his baby sister. But he initially had a tongue tie and he had a really hard time latching. And his mom had seen so many different providers. And after I saw her one time early on, because I was shadowing her lactation consultant, and I said a few things. She actually happened to be an occupational therapist, so she kind of spoke my language. And I mentioned a few things. I gave her a few things to work on, but I didn't think I would hear from her again. And then a few months later, she contacted me and said, I feel so bad because I feel like I listened to other providers telling me that everything was okay, and I didn't trust my gut, and I knew something was wrong. And now he won't move his head out of this position. And he was probably like 6, maybe 6-ish months old by that time. And he wasn't rolling very well. He would only roll to his side every so often. And it was something that she was really concerned about. And I came in, and sure enough, he had really obvious torticollis, and he was delayed in his milestones. And so we started working together, and I commend this mom so much. I think I worked with him every week or every other week for about 6 months. and it was so thorough, and she was so in tune with his needs. Because he was older, he was also able to communicate really well when he was like, no, please stop massaging my neck. I'm all done. It was really obvious when he was done. So I did a lot of manual therapy, a lot of body work on him with his consent, and he really loved it. And as he got older, he started getting more and more mobile. So he really quickly, just with a few of those little rolls and helping his brain learn the pattern, he figured out rolling almost right away. And he was up on his knees and rocking and just kind of moving really rapidly through those milestones. By the time he was 11 months old, he was walking. And it was shocking to all of us, but he figured out what he needed to. All the pieces put together. He had been such a fussy baby. He had been so frustrated, and he really just wanted to move his body. But once he got those milestones, and throughout the whole process, he still had his little tiny tilt, but we worked on it so much. And even now, he's like over 2, but even now, his mom really sees the tilt still, but I don't think that it's impacting his development anymore. And he seems like he's good to go. But the tilt is so hard to get rid of. So I think every physical therapist out there listening to this is like, oh, I know what you're talking about.
Oh, cheers to all physical therapists. You guys do an amazing job, because it's so crucial, especially early on. If you notice a difference, if you can address it, I mean, it literally, it's a life-changing for a baby and for parents as well, because parents, I mean, they don't know what to do, right? They're frustrated. They just...
Yeah. I have another family, this will be shorter, but I have another family who went to the pediatrician, and the pediatrician said, well, looks like your baby has a pretty flat head. Have you noticed that? And the parents had not noticed, but they're engineers. And so once they were looking at him from that angle, they were like, how did we miss this? And just completely heartbroken, So they're another family who we've been working with every 2 weeks, and they are doing everything to the T. And really, that's what matters. It's if parents take the advice and do the exercises that we recommend. And it really has made a huge difference already, even in just a month of working with him.
So beautiful. Thank you for sharing those stories. So what advice would you have for new parents feeling overwhelmed, especially in finding a balance between structured activities and playful learning?
I think playful learning should be at the heart of anything structured. Does that make sense? So I really believe that when you are thinking about helping with your baby's motor development, you almost don't need to do anything except play. And as long as the play has a lot of variety, you're going to be in a really, really good place. There are so many apps out there that give you like, you have to do this in week 1 with your baby. And I really believe as long as your baby is getting a lot of time on the floor in a flat place with a lot of, opportunities throughout the day, because I know a lot of families who do tummy time once in the day, and it's not enough. And I think there's a recommendation out there that you need to do 30 minutes of tummy time once a day. And I just don't agree. I really think it's more effective to help a baby roll into tummy time and maybe right back out, and then roll back into it, and then right back out. And maybe you do that every diaper change. So the baby is getting the frequency of tummy time. It doesn't feel like a scary thing that happens once a day. It's just part of the routine of the day that we're on our tummy sometime, we're on our back sometimes. And also I want to mention that being on your tummy against mom or dad's chest counts as tummy time, especially in the first month. But being on the floor is always going to be more effective. And you will see your baby get strong so fast. It's really, really remarkable. But
these are amazing at learning. If you give them proper environment, they're so quick to learn.
Yeah, and they're meant to. We almost don't need to intervene if a baby has normal, typical development. That's why, I don't see every single baby out there. It's because a lot of babies don't have torticollis. A lot of babies are perfectly fine in their development. They don't need intervention. And those are the babies who have free reign over a really safe space. They're the babies who can be put on the floor and enjoy their time by themselves looking at an object, or maybe looking out the window. The window is an incredible tool. Taking your baby outside and laying them in the grass, such an amazing is. They love to look at trees. It helps with their visual development. I think for a typically developing baby, the less we do for them and to them, the more they will feel empowered and confident to do for themselves and reach their milestones as soon as they need to.
Thank you. It's so beautiful. Anything that kind of touches babies, and it's so, if you think about it, for parents, you kind of embarking a very beautiful journey, right? You have a newborn and you do have to teach it how to go. But as you said, sometimes the less you do, like the less work you do, sometimes the better, because nature kind of already designed for babies to grow a certain way, right? If you don't stress out too much, it's like, oh, what should I do next? What should I, like, what toy to get? Just talk to your baby, play with your baby in environment, floor, being on the floor, or taking it to the park, just laying a little mat and then just observing. And the first few months, baby doesn't need much of like, oh, like going this way. It's like just slow movements. Yes, like movement is like any type of movement you can do to the baby to activate the brain and all the senses the best, but also allow your baby to move on its own, right? Just give a little bit of space.
Yeah, and try to learn from your baby, because they will teach you what's interesting to them and what they are excited about playing with. I was just this morning, I'm actually looking at this little playpen that I have for my baby, and I now have a bunch of these spaces around my house. We don't have any floor space anymore because it's all locked in for her, because my older kids have Legos. So we have to keep the choking hazards away from the baby. But this morning I had left her in her little area and gone to prepare to talk to you. And I was listening and I heard a like knocking kind of sound. And I went and poked my head around the corner, and she saw me and was like, come here. And so I went inside her little play area with her, and she didn't want me. She just wanted to show me something. And so she had this little weird wobble thing that's actually a toy for an older kid, but it functions as a bowl essentially. And she was putting one of her blocks in there and moving it and listening to the knocking sound of it. Figured it out. And then she took it out and she put a different item in there and knocked it around and listened to it. You don't need toys that make a lot of noise. Your baby will figure out ways to make noise with toys. And it's just so incredible. And she just wanted to share that experience with me. And that was me playing with her this morning.
Oh, that's so beautiful. Emily, you have an amazing platform and you're experiencing so many things. Can you please talk a little bit about your platform and how people can find you?
Yes, absolutely. So you can follow me on @BeWellBabyPDX on Instagram, BeWellBabyPDX.com if you want to navigate to my website. I have a 6-month container for high-risk pregnancy. So if you're over 35, and honestly, I have people in there who are not yet pregnant who are interested in learning. I have people in there who are not high risk, who are interested in just diving really deep. We meet every week. I do all of the movement and get your body really ready for birth. I have meditations, and then I have all of your birth education, all of your prenatal lactation education, everything that you could possibly need to get ready for meeting your baby. So that's a 6-month program. I also have online coaching. So if you ever wanted to work with me one-on-one, get my opinion on anything, I am happy to do that. And I have a postpartum program as well. I follow families every week on Zoom, and we all meet together and talk about baby development. And you're welcome to reach out to me about that as well. I've got so many different things going on. In Portland, I do home visits only a few times a week now because of the rest of the things I have going on, for pelvic floor PT, for lactation support, for infant development, and everything I offer, craniosacral therapy, all of it. I think that's it.
You have a long list of things you do, but it's amazing though. And I'm super happy for families who work with you and who following you. The work that you do, I mean, as you said, you found a little niche that needed to be found, right? Because you go to a clinic, you go to a pediatrician, but sometimes maybe some information is not been provided properly to the families, but they have that instinct that something is wrong. And parents, they do kind of go stressed out in unknown situations, like what can we do? And it's super helpful, the resources like yours that they can rely on and seek proper advice, which is amazing. Thank you so much, Emily. It was very informative podcast. I enjoyed a lot because it kind of brought those early memories with my kids. It's so beautiful.
It was my pleasure. It was really my pleasure. Nice to meet you too, Natasha.
Thank you so much.